Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Qadri bin Abdul Rahman. My material number 254 CSC. My title for research in quantitative science 2 is Assistant Dynamic Model in Method Problem in Malaysia. Okay. Introduction. Mental health disorder in a main community will be important through the work. It given that to consider the percentage of well-being complicated in among nations. By 2020, mental illness is expected to be the second biggest health problem affecting Malaysia after heart disease. Every 3 into an adult aged 19 years and above in Malaysia suffer from symptoms of mental health issue. Lack of understanding about the disease is related to the same mental disorder cause and possible side effects identify early signs of major mental illness based on the data shown from newspaper News Straits Times clipping in 28 May 2020 show that the trend of increased mental health case can be seen in the figure. Okay. For the 1999, 19 and above, only 10.6%, but in 2050, we increased to 29 and 0.2%. Research objective. First, to identify the significant factor of mental illness problem in Malaysia. Second, to develop a system dynamic model of mental illness problem in order to analyze the relationship between identified factors. To propose solution to reduce the mental illness problem in Malaysia by conducting intervention using development model. The scope of the research, this study will focus on patients with mental illness in Malaysia to investigate various factors and find treatment intervention to reduce the problem. Data used in the study is secondary data from Mental Health Performance Malaysia 2015. Secondary data contain of the 2 years record which in 2014 and 2015. Based on the year of historical data, this study will be predict number of patients until 2020. Formulation of dynamic causal law diagram. Causal law diagram is an intention to increase cost. Inspect the cause and effect relationship among variables in the system. By using CID, both quantitative and qualitative variables in the system can be incorporated. The element of the system and the interaction between them are important in order to understand the behavior of the system. In figure show that the arrow mark which positive and negative sign. For the factor on the mental illness is drug abuse, family infection, alcoholic, environment and physical activity. For the treatment is psychotherapy, medication, psychotherapy plus medication. When factor rate increase, the patient will be increased, but when the treatment rate increase, the patient will be decreased. Okay, next formulation of simulation model. Figure 3 show an example of the start and flow for mental illness model. The process start at birth rate and lead to the yearly birth. Yearly birth is influenced by Malaysian population and birth rate. For instance, if the number of population is 392,000, the birth rate will be more or less depending on the actual number of marriage. The equation will be birth sama dengan birth is equal Malaysian population time birth rate. Yearly birth can be calculated by birth rate. Similar to real death, the equation for that is death rate divided Malaysian population. Birth as an inflow into Malaysian population and this start as an flow to death at the end of the boundary. This means that Malaysian population are increased by birth and decreased by death. Okay, structural validation. From the figure, it shows that the simulation data from Malaysian population increase. We can predict that Malaysian population in Malaysia can be increased by year. Okay, for Malaysian population in 2014 increased to 2014. We can see the line. Okay, based on the picture, show that number of patients increase every year 2014 until 2020. It shows that mental illness is very dangerous because it is hard increase every year. Okay, we can see the patient 2040 is 382,506. 19 patients, but in 2020 we can see 600,000, 500, 5,500, 200,281. So the patient is increased by the year. Next, model experiment. We go show the group of factor rate and treatment rate that influence patient. Patient should continue to increase as factor and treatment rate increase. The value of group can be seen in the table figure 8. For the current model, the higher patient is 500,000, 55,000 and 8,600. Then the graph we can see that the patient is the highest to factor rate and treatment rate. Next, intervention. First, applying intervention 1, awareness campaign. Second, the number of patients increase year by year based on factor alcoholic, family fashion, reliable environment and physical activity. People nowadays busy of work and hours stress, also don't have enough time to care about the body and mental health. On a campaign need to make people aware about the factor and encourage people aware about the mental health. Okay, we can see the intervention 1 and the intervention, and intervention 1 can be decrease the mental health. Okay, for the intervention 2, Islamic treatment, psychology and medication treatment into a control method from getting worse by patient persistence and support from the pupils surrounding are really treatment which help from God. So getting closer to God will make our life better. Islamic treatment is one of the God alternative treatment used to help decrease good patient of mental illness. Okay, we can see that this line is for patient in mental illness, but this when we intervention the Islamic treatment, we can see the graph is decreased. Next is comparison of patient for all intervention and current mental illness. For the graph, we can see that Islamic treatment is the best solution to decrease the mental health, but awareness campaign is good for the campaign in the area in the higher mental illness, because campaign and Islamic treatment can be combined to the solution for the decrease the mental health. Okay, conclusion and result. In conclusion, there are two interventions provided in this model. All interventions show that result of number of patients is lower than current model. It shows that the best intervention in this model is Islamic treatment, which is the second intervention in the model. Referring to the goal of the study is reducing the number of mental illness patients in coming year. We find that the intervention of Islamic treatment is better than awareness campaign. For upcoming year, which in 2021, extra and extreme intervention are needed to help mental illness patients, because according to World Health Organization of Mental Health Day in 10 October 2019, the focus topic for the suicide. Nowadays, suicide is the most choice that have been chosen when people are not enabling to cope with their mental state. Thank you.